We're going to now begin rounds of 5-minute questioning, and I will start that out. Secretary Cardona, like many of my colleagues, I am troubled by the ongoing FAFSA implementation issues, and I'm also deeply concerned that the number of our high school seniors who have fully completed their FAFSA is down nearly 30% from last year, and even lower among students in low-income schools. I know that your staff is working hard to fix this, but as I said earlier, the department has to get this right, and fast. Can you briefly describe what you and your staff are doing right now to get FAFSA back on track, including increasing completion rates this year so students don't lose access to financial aid?
Yes, thank you, Senator. I can assure you that this issue is something that I take very seriously, very personally, and I acknowledge the frustration and challenges that families and schools are facing. 30 years ago, when I was ready to make decisions about higher education, I never filled out the FAFSA. I was probably eligible, but it was such a big task that I was intimidated by it, and I didn't want to put that pressure on my family to go through that process. It felt too difficult. And for far too long in this country, too many students that have potential have missed out on federal aid dollars to chase their dreams. So I recognize the frustration and the challenge, but the problem that hasn't been touched in 40 years. The rollout of the Better FAFSA has been riddled with delays and challenges, and it's been something that we've prioritized at the Department of Education. We're doing everything every day to make it right. We are holding FAFSA clinics. We are providing daily communication to colleges. We have sent information out over a month ago to schools, and we are on daily calls with college presidents, financial aid directors, hundreds of webinars in different languages. We are visiting states and helping with clinics for families. We have if you visit ed.gov, and there's a spot right there where you can see resources for Better FAFSA. Just yesterday, I was on the call with national community-based organizations who've signed up to hold clinics to make sure that they're connecting the dots with schools. And we're providing day-to-day support to educators, parents, students, based on what we're hearing. We recognize the importance of this, and we're doing everything in our power to make sure we're providing more opportunities for students to fill out the Better FAFSA. At the end of the day, we're expecting the Better FAFSA can open the doors to an additional 600,000 students for higher education, and that's a huge difference for the potential of our country and the potential of our students.
Thank you for that answer. While we are still working on FAFSA this cycle, we know that next year is right around the corner, and students cannot bear another year of delays. So can you commit to an on-time launch for the 25-26 FAFSA by October 1st of this year? And will you commit that colleges will get all the data that they need from the FAFSA as soon as the FAFSA is launched?
Thank you. Yes, this is something that we've been focusing on while we're rolling out this year's FAFSA, thinking about next year's FAFSA. And I commit to make sure that we're moving all of our resources to make sure that we adhere to the timelines and do everything in our power to make sure not only that we're staying true to the timelines, but also communicating with parents, students, and schools.
Okay, so will you be able to reach the October 1st deadline?
That is our expectation, to reach the October 1st deadline.
Okay. Mr. Secretary, I appreciate the work of the Department and Administration on increasing access to mental health services for children and youth and related proposals in the President's budget. While you've made some progress, while we've made some progress, certainly more needs to be done to overcome challenges that I hear about in Wisconsin, frankly, every day. What I hear about is kids, getting kids the support they need. And I'm also aware of the interest back home in the department's school-based mental health programs funded out of the School Safety National Activities Program. We provided $216 million for that program in the budget that we just passed and directed the department to use any funds not needed for current activities for new school-based mental health grants. Do I have your commitment to use every available dollar from the School Safety National Activities Program for new mental health grants, just as we directed in the recently passed budget?
Yes, we are committed to adhering to that.
Thank you. And can you describe how this budget request would expand and improve school-based mental health services for kids?
Absolutely. I have to tell you that, one of the things that I feel pretty strongly about as an educator who has had experience even before the pandemic addressing mental health needs in our schools, that if the disruption of the pandemic results in us going back to the systems that we had for providing mental health for our students, we're failing our students. We are in a youth mental health crisis, and unfortunately across the country, we have emergency room models of mental health support, meaning after the trauma. We are committed to ensuring that funding and supports for schools are available to make sure that students have the proactive support that they need. I have to say, thanks to the Bipartisan Safer Communities Act, we've invested already $571 million in mental health services for students in K-12. We are committed to continuing to provide support. Funding for in our budget proposal that is geared toward community full-service community schools will also bring in community providers to help students and families with mental health needs. There's a $40 million grant to K-12 mental health services. And what we're seeing is that some of it is proactive, just helping students understand how they're feeling and communicate emotions. And we're also seeing an increase in support providers. There's been a 40% increase in school social workers. That's significant given where we are as a country. We've seen an increase of 25% of school nurses, which is, again, something that I know for the families and students that benefit from that, they're thankful. So we're committed to keeping that trajectory moving, recognizing that a strong system of mental health supports for students is the foundation for academic progress and students reaching their potential.
Thank you. Senator Capito.
Thank you, Mr.